Hello, everyone, and welcome to today's industry webinar, Navigating Regulatory Programs and Why You Should Care. My name is Ellen Knowles, and I'm the Marketing Communications Manager at Azalea Health, and I'll serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default. If you would prefer to join over the phone, just select telephone and the audio pane on the right-hand side of your screen, and the dial-in information will be displayed there. You will have the opportunity to submit questions during today's webinar by typing your questions into the question pane of the control panel. You may send in your questions at any time during the presentation, and time permitting, we will address them during Q&A at the end. Today's webinar is full of information, so to help get to know our audience better and keep everyone engaged, we will have several polls throughout the webinar, so please take a moment and respond to those as they appear. Also, please note that today's slides will be shared in a follow-up email along with the webinar recording after this presentation in case you want to review again or share with any of your peers. I would now like to introduce our two presenters today. We have Derek Mitchell, Regulatory Support Specialist. Derek is an expert in reading measure specifications, understanding measure calculations, and creating workflows to optimize regulatory performance. Next, we have Margaret Chandler, Regulatory Consultant. Margaret is a subject matter expert in federal regulatory programs, helping practices navigate the requirements and incentives available. Margaret helps Azalea Health clients with their regulatory strategy, while Derek assists clients with their tactical plans to achieve those strategies. So with that, let me go ahead and turn today's presentation over to you.
Good morning, everyone. Again, my name is Derek, and I'm here to go ahead and help you understand what our regulatory programs are and why they should be important to you in your practice. Today, we're going to be discussing several items. The first of which we're going to discuss today is the very high-level crash course in MIPS, basically what it is and how it applies to you and what you kind of need to know. Then we're going to be discussing the 4 different areas of MIPS, each of their categories. Then we're going to talk about each person's specific role in the practice and how a single person should not feel that it's really not their job to contribute to the MIPS program. Next, we're going to talk about how everything fits together and how your teamwork will guide you to success when everyone buys in. We'll also be discussing your numbers, what they are, how you can own them, command them, and adjust everything to help better your success with MIPS. And then we're going to give you a wrap up that kind of shows you the bottom line of MIPS and how it applies to you. Today, our message is mostly about teamwork and team effort. We here at Azalea Health feel that it's team effort and everyone that has a value to a part to play in making sure that you're maximizing your impact on your MIPS performance. So let's go ahead and start with our crash course in MIPS, understanding what it means and what it means to you. So MIPS is the Merit-Based Incentive Program System, or MIPS, as one of the 2 tracks under the Quality Payment Program, which moves Medicare Part B providers to a performance-based system. This is a very basic description of MIPS. Essentially, MIPS is a program that is designed to showcase to the government, your community, and your individual patients how well you deliver your healthcare services on a daily basis. What this means for you, however, is that there's a few things to know. MIPS is a bipartisan supported program that shows the value of the work of your practice. It's also, your MIPS performance is available to the community as general through the CMS's Physician Compare website. And CMS will also use your MIPS data to incentivize the work based on the key performance indicators, or KPI, as set by the national benchmarks with similar practices. Just a few things to note about this and why it's important for you is year to year, MIPS raises the level of competition between provider organizations and increases the financial and reputational impacts to the clinicians. Also, that because it is a bipartisan supported government program, the Bipartisan Budget Act has mandated that CMS actually gradually increase the MIPS performance threshold each year towards becoming an historical mean or median in the 2022 performance year. As a result, this makes MIPS feel like a treadmill that both increases in speed and difficulty. Thus, we feel that it motivates clinicians and organizations to put quality incentive programs in place now in order to stay ahead of the competition as the program gets more and more difficult. So as hard as it is to adopt now, it'll only get a little bit harder every performance year. So we really do feel early adoption equals less pain later. MIPS and Medicaid promoting interoperability programs are not mutually exclusive. You may be required to participate in both, making the strain even greater for those who elect to not adopt early. So again, early adoption is key. If you've got a game plan in place, it'll help you meet these growing and increasing difficulties as the years progress for performance. So now we're going to talk about the 4 various categories of MIPS, basically to just kind of underline what they are and how they can help you. So as mentioned, we want to go ahead and discuss the fields of MIPS in the various 4 categories. So our first category is going to be quality. This assesses the quality of care that you deliver on the measures of performance or the KPIs. That basically is how well your providers are providing their services. We have the improvement activities, which assesses your participation in clinical activities that support improvement and patient engagement, care coordination, and patient safety. We also have our promoting interoperability, which focuses on the electronic exchange of health information using your certified electronic health record technology or your CEHRT to help improve patient access to their health information, exchange of information between your providers and your pharmacies, as well as systemic collection, analysis, and interpretation of healthcare data. And finally, we have our cost category, which assesses the cost of care that you provide based on your Medicare claims. Cost measures are also used to gauge the total cost of patient care during the year or during a hospital stay. Okay, and
we're launching our second poll right now. So out of the 4 categories that Derek just discussed, let us know which area is most challenging to your practice so we can get a good idea of what, what areas are a little difficult than others for you. We'll take a moment to answer that.
Okay, can you give me that reference number? Okay, no problem. This is regarding Dr. First.
All right, thank you for answering, and we will move on to the next.
So next we're going to talk about promoting interoperability. This seems to be a pain point for some of our people on today. So one of the things we need to note is communication is the name of the game. It's all about communicating between the practice, providers, pharmacy, and patient. So that means that MIPS is focused on transparent dialogue between, like I said, not only the providers, but other providers and with the patient and pharmacies. This is basically designed to make sure that you send and receive your summary of cares, your referral notes to and from other providers and facilities, as well as help the patients be engaged in their care decisions by allowing them to see their data, educate themselves via the tools your CEHRT provides them. And this may be something as elaborate as a patient portal, or even just a series of handouts that can be printed from your CHERT, I'm sorry, CEHRT, and provided to your patient. The goal of this really is just to make sure that there is an open dialogue between the providers and the patients, and your clinical staff, and that everyone knows a game plan for dealing with the patient's care. To further elaborate on this, your CEHRT will have some tools such as secure messaging, dealing with referral loops, and even patient portals. Now, the secure messaging, while not included on this year's performance year, it was included in last year's, and that does mean that it may or may not make an appearance in future performance years. But either way, it's a good thing because this allows you to allows you to send messages from your providers to advertise services that are meaningful to your patients. Flu shots, school physicals, annual wellness visits. You can send them en masse to your patients and get that turn in and appointment set to drive your appointment counts. As well as getting your practice to communicate with the patients means that they may be more apt to recommend you to a friend or family, because really nothing beats that personal touch for advertising. It gives the appearance that your doctors are more engaged, your providers are more engaged, your staff is more engaged, and just generally sets that you can come to us with your questions attitude, and helps the patients feel comfortable with you. Your referral loops are important, but I found with a lot of our Azalea clients that it's one of the pain points that they have, not necessarily due to not having access to send to this information, but really because there's not a lot of buy-in in their local areas. We have some rural centers that may have issues because their providers in their areas simply don't have a secure way to send to referral loops. So it's a really good thing that for now CMS is being lenient and allowing this to roll over into other aspects of performing interoperability. But that may change as I said earlier. CMS has set this to grow ever so more difficult every performance year. And then the patient portal, if offered by your CEHRT, is one of the more important aspects right now, because you need to have your clinics buy-in, because it will allow you to compensate for when you can't address the referral loops. And later we'll show you why. Most of the CEHRTs have some version of this, and it should be something that is given priority when setting new patients or updating existing patients. The sooner you get your patients involved, the easier it will be when there are more stringent requirements about the patient portal. As you can tell, we're really trying to focus on early adoption and getting practices in place as early as possible to give you a buy-in to get the success that you need to get as much as you can out of the MIPS program. Now, the next item on the agenda is the electronic clinical quality measures, and these are your evidence-based benchmarks that are used to guide your practice in delivering effective, safe, and efficient, patient-centered, equitable, and timely healthcare services. There are a wide variety of electronic quality measures that are available, and while you're generally only required to attest to 6, that number may be more or less based on your facility's specialty. We do encourage that you visit the participation's website and see what you will be required to attest to. Generally, before starting any kind of regulatory program for the year, you should have some idea of what measures you're looking to meet. Your regulatory team will generally help you make that choice, but if you're going to go without a dedicated regulatory staff, a good rule of thumb is find the measures that align with your current workflow. That will help ensure that you have the greatest potential for success. Generally, the partnership between you and your CEHRT is there to help to ensure that you'll be able to command those numbers. You will be able to proactively monitor your progress, and we strongly suggest that at a bare minimum, you do so at least once a quarter. This gives you the chance to not only monitor your numbers, but notice negative trends and opportunities for coaching within your clinic staff to get them back on track. This also allows you to identify when things are not working correctly within your CEHRT, and if an unintentional change was made, knowing your status on a regular basis can help assisting with getting that resolved before your deadline. As you can see, having all of your staff's buy-in in the program adoption, working toward a common goal, will make things a lot smoother. I have seen administrative staff try to handle this all by themselves, and really it becomes too much for one person to bear. Teamwork is the only real key to success when dealing with regulatory programs. Establishing standard operating procedures, SOPs, or workflows will help make sure that your staff is effectively documenting the data where it needs to be. And with that, I'm going to hand this off to Margaret so that she can discuss the next ones.
Okay, so our third category is called improvement activities, and these are activities intended to assess your participation in the clinical activities that support how you're engaging your patients in meaningful dialogue about their healthcare, support your deliberate organization of patient care activities, basically care coordination, support how you protect your patients from errors, injuries, accidents, infections. So those are kind of the categories of improvement activities. And some examples of these are participation by the eligible clinician or group in the prescription drug monitoring program of your state where they practice. That would be an example of an improvement activity. Another one would be care coordination agreements that promote improvements in patient tracking across all the various settings where patients are seen. So those are usually done outside of your EHR, but they're one of the categories that you have to report on. So we want to be sure to include them in this crash course in MIPS. And that takes us into our cost measures. Now, this is the fourth category. There are 20 cost measures in total for the 2020 performance period. It uses an attribution methodology for identifying primary care relationships. So that is one of the areas that we get a lot of questions about, and we're glad to help with. The third point about cost measures that you need to know is that clinicians don't need to collect or submit any data for cost measures. CMS takes care of collecting and evaluating the data for you from your claims. So the point of the cost measures are to assess the cost of care you provide based on your Medicare claims. And they're also used to gauge the total cost of patient care during the year or during a hospital stay. And you're probably thinking, well, I don't have any control over the cost of a hospital stay. So even though a clinician doesn't personally determine the price of individual services provided to Medicare beneficiaries, you can affect the amount and type of services that are provided to your patients. And by better coordinating and seeking to improve health outcomes by ensuring your patients receive the right services, clinicians play a very meaningful role in delivering this high quality care at a much more reasonable cost. And that takes it back. I'll toss it back to you, Derek.
All right, thank you so much. So now we're going to talk about accountability and purpose and understanding your part of the team and to practice. We really do want to show you and your practice a very high level overview of what each type of staff has to offer the MIPS program. This will help you get that buy-in and show you what each member can add to the overall success of the MIPS program.
And real quick, we went ahead and launched our next poll. Let us know what your role within the practice is. We will go through these different roles and what your purpose and accountability will be with participating in MIPS. So real quick, just take a moment, let us know what role you are in within the practice. Thank you.
Thanks so much. So we're going to start with front office staff. Now, the following functions and purpose deals with the administrative and front office staff and how their effect on MIPS may be. So as you see here, the purpose is your administration staff, scheduling, referral, your medical records staff, and most general non-clinical staff members we kind of group into front office in this regard. These team members are liaisons between the clinical staff and the patients outside of the patient visit. They are very critical in ensuring that non-medical aspects of MIPS are followed through and completed. Some of the items where they can assist and be accountable for in the MIPS program would be setting up the patient's records and maintaining them, making sure we have the proper insurances and things like that, so that as you're doing your MIPS accountability for costs and everything, they're being recorded properly in your EHR. Scheduling your appointments and referrals and sending out the referral notes, getting that process done, and getting it incorporated into the EHR and getting those scheduled is a very key part in that as well. They can also assist with enrolling the patients in the patient portal when they're setting them up or updating the records, as well as releasing that information to the patient portals. And specifically for your administrative people, training new providers and staff on critical workflows designed to help you maximize your MIPS accountability and data documentation. That's some of the main key points where your front office people can definitely help. We do hear that, from time to time that the front office staff doesn't necessarily grasp where they can help in this, and they feel like they want to do more but really can't. So we wanted to kind of outline the things that they can focus on to try and get a good idea and get that buy-in to help and show that even your front office receptionist can help some to help you get that game plan in place for MIPS. Now, the next one is Scribes. Not all practices utilize Scribes. Some do, some don't. It depends on your provider and workflow setup. But Scribes really do help ensure that providers' visits are properly documented based on that provider to patient interaction. Scribes in some cases could also be part of the front office staff based on your practice setup. So much like a provider, the scribe will utilize documented workflows to ensure all relevant information is properly documented and coded on their charts, ensuring patient education is released to the patient portal on behalf of the providers, and ensure that the charts are getting signed in a timely manner by the providers and expediting chart entry for those providers. So your scribes are basically going to be sitting in the rooms or even dealing with dictations. So their key goal here is to get it done as fast as possible so that they can meet the deadlines required for promoting interoperability requirements within MIPS. And like I said, not all practices will utilize Scribes, so that may or may not apply to your practice, but if it does, making sure that they're on board and buying into your MIPS program will help the whole team as a whole. Next comes our actual providers, and the providers' purpose is real simple. They deliver the needed healthcare services within your practice. Providers will also provide an example to your mid-level providers and your clinical staff about what is expected as normal operating procedures. That means if your providers will buy in and follow the documented workflows, then most likely your new mid-level providers and your clinical staff will as well. So this is real key to make sure that the buy-in starts at the top and rolls down for all of your clinical staff, so that if the providers do it, then they'll be more apt to do it. And part of the provider's accountability, much like the scribe, is utilizing those documented workflows to ensure that all that relevant information is properly documented within your EHR, and then ensuring those charts are signed, both theirs and the ones that they're responsible for reviewing, if that's the case, in a timely manner. So generally speaking, providers have about 4 business days in the MIPS program to get their charts signed and released to the patient portal. So this making sure that they're on board and that buy-in helps achieve that with little or no problems. Next comes our mid-level providers, and we group your clinical staff, your LPNs, APNs, RNs, PAs, and or even new junior doctors in this group here. And this could vary based on your practice's setup. So again, their accountability is also utilizing those documented workflows. The workflows are going to be your key to making sure that the information is entered correctly every time on every chart. They're also responsible and accountable for signing their charts, as well as making sure that their reviewing providers know that their charts are available to be signed. So again, it's all about communication between your providers in your practice and your clinical staff within your practice to make sure that that information gets done in a timely manner and gets released to your patient's portal. Next, we're going to talk about synergy of MIPS, the game plan and how it all fits together. Now, this is really the crux of everything that we've been discussing so far. The idea is teamwork is teamwork. That's what we really want to push here, to make sure that everybody grasps how they're working together and how they're important, even if they don't necessarily think they are at the beginning of this. One of the things is everyone has a piece to hold in this puzzle. At this point, we've shown what every member of staff can do to contribute to your practice's general success. Now we want to show you how it kind of all fits together. And this is where you'll see why teamwork, communication, and team member buy-in is really, really important. So doing your part, as we mentioned, from the moment that your patients step into the practice, your staff has something that they can do to contribute. Your front office staff will check in the patients, create the patients as needed. They'll verify all of their information, and they'll also check out the patient at the end of the visit, ensuring that your referrals and everything are taken care of. Now, at this stage, your front office staff can ensure that the demographic information is up to date, and they can verify whether or not your patient has signed up for the patient portal. And if they haven't, they can sign them up now. Now, one of the good points about the patient portal is that for the promoting interoperability portion of that specific measure for MIPS only requires that you actually just invite the patient to the patient portal. It is just making sure that the patient is enabled to have the information to sign up and set up their account. Doesn't necessarily mean that they have to actively sign in or even set up their account, as long as they're given that ability to do so. Now, after the front office staff gets your patient ready and in the system, that hands off to your clinical staff and your mid-level providers. They're generally the ones who will prep the patient to see the provider. They'll do this by ensuring that they're documenting all the vital information, as well as utilizing some of the basic clinical quality measures such as hypertension and BMI, just making sure they're getting their vitals and getting those recorded properly on the chart. By utilizing the tools of your EHR clinical features, you could have pre-designated templates to help you based on the type of visit to accommodate some of the eCQMs automatically. These will usually be set up by your administrative staff and then fine-tuned at a later point by your provider's feedback. Once your clinical staff and mid-level set up the patient and gather the basic details of the visit, why they're in, their chief complaint, things of that nature, that's when it'll be handed off to your providers to come in and deliver that primary healthcare services that you're offering the patient. In some cases, the mid-level providers may handle this as a result of your current workflow. Once your provider comes up with that plan of care, the mid-level providers and clinical staff will usually step back in and carry out that plan of care. And generally, this is the last step before the patient's released back to the front office, but that could vary based on your own practice workflows. So we're just speaking in general workflows at this point. And then once again, at this point, your front office staff will coordinate any needed follow-up appointments, referrals, and additional questions. Then this is again where it comes into that 4 business days. Depending on your office's workflow, within those 4 business days, the chart should be signed by your providers and then released to the patient portal to be viewed by the patient should they desire. One thing I do want to mention, that if you're planning on dealing with both the Medicaid PI and the MIPS, you should strive for a 48-hour window, as the Medicaid PI has a much more stringent requirement for this promoting interoperability. So as it says here, everyone matters or nothing matters. It's the team goes or the team fails. So even that front office staff, if they are not in the buy-in, it's not going to work for making sure that you're all getting your most highest score on the KPIs. So now I'm going to hand this off to Margaret once more to talk about scoring methodology.
And here in the scoring is where the teamwork and owning your workflow really pays off big. This is where you see the results of your work. And we talked about the 4 different performance categories in the program, and each performance category has a different weight. And here on this slide, we show that weighting as a percent. So these 4% add up to 100. I really like to think of these as points. So, obviously quality has 45 points, or the lion's share of the points, and that's assessing the quality of your clinical care. So a lot of that is covered in your clinical workflow. Now, the other category, the cost category, the 15%, that falls to your administrative staff with their claims and getting, how everything is documented on the claims and submitted on the claims. The improvement activities, that's 15% of your score. And this is, depending on the activities you choose, this is going to affect everyone in the office, every staff member. And I did see that a lot of people said that the improvement activities were one of the areas that they struggle with the most for, in overall, as far as the category that they struggle with the most. And so we'll make a point to have another webinar on that to try to help everyone out with that. Now, the next highest scoring category is the promoting interoperability, and that's 25% or 25 points. And Derek mentioned this, how important the patient portal is in the promoting interoperability category, because it's almost half of your 25% is inviting patients to the portal. So now I think the thing that confuses people the most about the scoring methodology, and if I heard this once, I heard this 100 times over the course of 2019. Well, I got my one patient in the patient portal, or I got my one prescription prescribed electronically. Well, that's just the ticket that gets you in the door. You have to get as high a score as possible to measure up against the benchmarks, to measure against the other providers across the country. You want your percents and your points to be as high as possible, because there is a threshold, a minimum number of points that you have to get. So, and that 25%, if you just do one patient, invite one patient to the patient portal, you're going to be way down there in your points. So it's not just, I got my one. You need to do this consistently for every patient, for all of these categories, because you need your points to be as high as possible. So it's a percent of your patients. The percent of your patients that you invite to the patient portal is what's going to bump you up to get your full 25 points. So that's the importance of this scoring methodology. And of course, the goal is to get to 100. Now, that takes us into owning your numbers. And, why? Why not just do the best you can and send it in? A lot of people do that. But the reason is because you really do care about the quality, and you care about how much it costs to provide the care, across the board, and you want to maximize both of those. So Ellen has a quick poll here for us.
Yes, so if you can take a moment and let us know if you have a dedicated staff member who's monitoring your participation and performance, monitoring everyone in your practice to make sure that they are doing their part as well. As Margaret and Derek have mentioned throughout this entire webinar, it really is a team effort. So let us know if you are, or maybe you're not and you're struggling with that, and we can find some ways to help you improve that. And take another moment. We'll see some answers coming in. We'll collect those, and then we will move on to the next slide.
So you're probably saying, okay, I should own my numbers, but how do I do that? And there are really 3 steps. First of all, you need to understand the program, understand these performance categories, the measures in each categories, and how those measures are calculated. And then ensure that your workflow supports getting those measures calculated to give you the highest score. That's number 2. And number 3 is know the where to find the information, how to read it, how to understand the reports on your performance, and take advantage of the CMS feedback sessions. And you will know what your numbers are, why they're high, why they're low. Do you need to change your workflow? Where do you compare on the benchmarks? You'll be confident in your MIPS numbers and reporting. Now, should you choose not to, this next slide, the good, the bad, and the less pretty. The good is if you monitor early, you monitor often, and you adjust your workflows accordingly, MIPS reporting is not all that bad. It's just kind of part of your day-to-day life. But if you really kind of out of sight, out of mind, I really can't think about it today, then it's really hard to catch up. It's waiting till the end of the year and trying to catch up, it's almost always impossible. You might be able to impact it a little bit, but not nearly as much as you will want to. And then it gets worse. The less than pretty is if you wait until after the performance period is over and you're into the reporting period, there's very little that you can do to impact your performance numbers. It's almost impossible to do anything after after December 31st. So please get everyone on board and do it early, monitor often, and adjust, and that should really make a difference in how you view the program and your performance. So I'll toss it back.
Okay, and that brings us really to the bottom line. We want to turn unhappy providers into happy providers and successful providers. We're all here to try and make you as successful as possible. So what this means for you is, again, an opportunity to showcase your good work that your team does every day to the government, the community, and your individual patients. The importance of the MIPS program really needs to be taken seriously by every member of your team. MIPS thresholds, as mentioned, will get steadily more difficult every performance year up until 2022. So early adoption makes this less stressful and less painful. So starting this performance year, that means things are going to get harder. So you should start adopting workflows to help you get this so that you can take it in stride. Now, I know this sounds a lot easier than it actually is, but it is really important. Now, as Margaret said when she was discussing the scoring methodology and the weights of the different categories, just so you know, a score of 70 or higher will definitely give you a significantly higher increase in your 2019 payments, because that means you'll be qualified to share in the $500 million additional incentive funds. That means the better you do, the more money you'll make. bottom line. So that team buy-in and getting your team all in sync and getting this workflow down pat is going to mean more money for your practice. Following your documented workflows is not only key, but it's an absolute must. If you're hoping to get as high as possible score, you're going to have to follow documented workflows. Make sure that they're documented, they work, they're reporting correctly, and everyone is trained on how to do them. This is where the buy-in from every team member is absolutely important. If you're a small practice with one provider and 3 or 4 support staff, one person not following or not buying in could mean you do not succeed with MIPS. You will not get those big returns that everybody wants. The bottom line, though, is the patient must be core at every one of your policies. They should have no worries about the quality of care or anything. I mean, your patient should be number one. Now, it's easy to look at all these programs and feel extremely overwhelmed. That's why it requires teamwork. With everyone doing their part, the entire program will be a success. Focusing on plan participation, optimizing your workflows, learning more about your programs, and partnering with your EHR vendor, registry vendors, or even another provider will definitely help you with success. You're all trying to do the same thing, and even if it is a competition, as CMS wants it to be, it's definitely something that, hey, how do you do this? Will definitely sometimes help. So that brings you more money, which leads to, again, more money. So that brings me kind of what we can do to help. So what can we do as Azalea Health do to help you succeed regarding MIPS? So let's just discuss this real quick. So one of the things is we have registry interfaces. Azalea Health works with a variety of state and national registries to integrate them as much as possible into our system to take the strain off our clients. We're always open to exploring new options and new interfaces, and your dedicated success team will work with you from the first steps to the last steps to ensure that they work to the best of their ability. We also have integrated e-prescribing services. We have a dedicated team of support agents specifically focusing on ensuring that our integration with Dr. First is as painless as possible. As new versions roll out, they're at the forefront to ensure that any issues are captured, documented, and escalated to the appropriate resources. That means meeting your e-prescribing requirements is almost an afterthought. Once it's set up, you forget it. So in the words of a famous infomercial person, set it and forget it. Our patient portal is included by default with all of our clinical aspects of Azalea Health. So there's no additional setup beyond just customizing it to what you need. And that's on all of our clients. So we offer it from day one to get you on the right track. We also have our referral loops, sending and receiving CCDA files through our partnership with ThyMail, which is integrated into our Azalea messaging system. So it's no more difficult than sending an email right from within Azalea. We also have a dedicated support and regulatory staff that's available at your fingertips. Our dedicated and knowledgeable support staff is there to address a wide variety of issues from workflows to general, how do I do this or how did this happen style questions. We have a regulatory team, both of consultative and supportive means to assist with getting you on the right workflows and keeping your practice on track for success. And lastly, a third-party research group did a time study on 8 leading EHRs for ambulatory practices. And out of all those 8, Azalea came out on top, making us about 37% faster than other leading EHRs. So we're not trying to necessarily toot our own horn, but we really have taken strides to help you guys be successful. We take feedback from our clients on a regular basis, implement their requests for enhancements as fast as we can or as logically as we can. So we're here to help.